where did this come from? What's the story behind this book?
Well, for many years I've been a GP, and I've wanted to really make sure that we address in the consultation all the angles of a patient's problem. Patients' problems sort of divide themselves into physical, social, psychological and spiritual, what I sometimes call the diagnostic cross. And so the spiritual angle, the worldview of the patient is often ignored, and the question is how to bring that into the consultation so that the patient feels free to express concerns about their worldview angle on the problem.
And why is it so important to write a book like this now? Why is it so timely?
The problem is that worldview is not something which most practitioners, most healthcare workers are happy to address, particularly in the UK. That's because they're a bit fearful mostly, and also because they don't feel that they have the skills to do it. People with no faith are worried about undermining somebody's faith by asking about it. People with faith are worried that they're going to get into trouble for talking about faith. So it's a tricky area. But actually, like any area in medicine, it's a matter of acquiring some skills and just learning some good questions and learning how to time it and how to put it in with the history taking.
And what are some of the main themes in the book, Graham?
Well, one of the main themes I have is that perhaps there's not really an appreciation nowadays that everyone has a worldview. Everybody lives with a worldview which informs how they act and the shortcuts they take in everyday life. And so this worldview then has an impact on how they respond to illness, how they handle illness, which starts with how quickly they will come to a doctor in the first place. And worldview will affect what they think about treatment. Some patients think that their illness is a punishment, and so they even will refuse treatment because they feel they should take the punishment. So there's all sorts of strange things going on. Sometimes somebody will have gone to an imam to seek an exorcism before they come to the doctor. These are all sorts of interesting things that are happening. People will have sought herbal remedies because they think that's helpful. So people's worldview affects when they come to the doctor, how they handle their illness, and then whether they'll accept treatment from the doctor, and the whole discussion and agreement with a healthcare professional about what treatment is appropriate. And as we've seen recently, just in the last 24 hours, worldview impacts the end-of-life care. People wanting to take their own lives and sort of take control, and that question of autonomy and what are the limits to autonomy. So worldview has a huge impact on every aspect of healthcare.
And finally, what is your hope for this book?
My hope for this book is that we will get rid of the fear that healthcare professionals have in addressing worldview issues. And I'm not just talking about Christians or Muslims sharing their faith with patients. I'm talking about all professionals, that they should have the freedom to explore these issues without fear, but of course with the patient's permission. And if the patient doesn't want to talk about it, well, that's fine. It's their consultation.